Across the country, nearly 700 women die every year during or after childbirth. Texas does poorly compared to the national average, but that is based on outdated information. This month, the state was supposed to have new numbers to tell us if we were headed in a better or worse direction, taking care of mothers after delivering a baby. Health reporter Haley Hernandez joins us now. So, Haley, when will we have those new numbers?
Lauren, it's possible we won't see new numbers at all in 2022. The last time the state released information was 2 years ago, and that contained information that's now almost 10 years old. In a report expected to be released this month, we were supposed to learn the most recent comprehensive data of how many local maternal deaths that we've had and the reason for those deaths. Most importantly, were they preventable?
In a statement from the Department of State Health Services, they tell me they're in the middle of reviewing 2019 maternal deaths and won't be releasing that information as expected. Their reason, they say the report and the underlying data are important. That's why we want them to be as complete as possible. But organizations who push to improve the health of mothers, like the March of Dimes, are anxiously waiting on that information to move initiatives forward, something the state says can still happen. A delay in publishing the report does not affect the work going on with hospitals and healthcare providers across the state. Because of previous reports, the March of Dimes says they've been able to work with lawmakers to extend Medicaid coverage for women 6 months after birth. Heather Butcher says their goal is to extend it for a year.
There's still the work being done. We just won't have that really up-to-date data. And when I say up-to-date, it was 2019 too. So we're going to still be waiting on some of those factors like COVID that have played into the last several years that weren't going to be part of this report.
Because information is sometimes released before cause of death is official, reports of maternal mortality can be released incomplete and updated later. While Butcher is anxious to have updated information, she says she doesn't mind waiting for an all-encompassing report.
And then legislators come back to us and say, well, you don't even know the numbers, or the number was too high before, it really isn't that bad, or they'll say it's too low. So we really want to have some good data to present to our legislators and the public and our funders as well.
Now, Butcher claims other states can process information and have updated statistics faster than Texas. The state tells me they are reviewing their internal processes to determine ways to produce more timely data, and they say that they're asking legislators what can be done to speed up this lengthy review process. Keith?
All right, Haley, thanks.